It is now a distinct honor and a pleasure to welcome the Honourable Minister Gary Goodyear. As you have heard just a moment ago, he's the Minister for State for the Federal Economic Development Agency for Southern Ontario. Prior to entering federal politics, not unlike his colleague, Minister Leake, Dr. Goodyear practiced as a chiropractor in chiropractic medicine and worked as an advisor for investment firms in the biomedical industry. It's not surprising that he actually engaged and has tremendous experience in looking at that intersection between health, innovation, and biotech in the business world. So it's a relatively rare skill set, and we are absolutely delighted that he's been able to share a few moments with us today. Just a few weeks ago, he joined us for the official opening of the Centre for Innovation Excellence in Alzheimer's Care in North York, which was funded in large part and made possible, again, by the phenomenal inspiration and support of Minister Goodyear. He is an absolutely tireless supporter of our centre, and we are ever so grateful that you've been able to join us this morning. So, Minister Goodyear, would you like to share some remarks?
Well, thank you very much, Anne. Good morning, everybody. That was a very kind introduction. Kelly, Minister Leach, I should tell you, congratulations, quite sincerely. Ladies and gentlemen, I've worked with Kelly for, well, since she was probably 15, 6 years ago. And she is a delight to work with. She is very, very busy. I sweat just reading her schedule. But Kelly, you are a great asset to the government, to this country. Congratulations on a well-deserved recognition. Mesdames et Messieurs, c'est un grand plaisir d'être ici avec vous aujourd'hui. I am so delighted to be here at the Ivey Global Health Conference. I think the theme of this year's conference, which is one of innovation, has the potential, in fact, to transform the healthcare system, and in many ways that's exactly what we need to do. I can also tell you that it is something that ties in very well with the Federal Economic Development Agency for Southern Ontario, or FedDev. We love our acronyms in Ottawa. So we call it FedDev Ontario. That is what we are most commonly known by. Now, it's no secret that innovation is the key to success, not just for the health sector, by the way, but for all sectors throughout this region and collectively across the country. It is important that new ideas and new products, new ways to make old products, new approaches to manufacturing and so on, these are crucially and vitally important to ensuring that our nation prospers going forward. And like Minister Leach said, I can tell you that the federal government remains completely committed to what is most important to Canadians at this moment in time, and that's exactly why, ladies and gentlemen, we continue to focus on maintaining and creating jobs, better jobs, new job opportunities that ultimately lead to economic success. We remained also focused, by the way, on doing all of this and keeping taxes low, returning to a balanced budget, maintaining our exemplary banking system that the world envies so much. We're committed to keeping your families and our communities safe and standing up for Canada around the world when it's necessary, and of course, being ever so vigilant about the uncertain global economy as it sits today. The results of our actions have become quite clear. As Kelly mentioned, some of the great news, we're #1 in the G7, according to the OECD, in the percentage of higher education spending as a percentage of our GDP. That's a great news story. We're #4 in absolute terms in the entire world in terms of the strength of our science sector. And we are leaders in the G7 in terms of our job creation over the last number of years during this terrible economic downturn, and we are, in fact, the envy of the world with respect to our balance sheets. But I think that we are hitting the point, at least here in Canada, if not around the world, where it is time to kind of turn the page and have a look at the next step. Obviously, keeping our eye focused on the turbulent economies around the world, but looking toward the future a little bit and toward the opportunities that are in fact unique to our country because of our management of the economy. Of course, we also look at individual regions in the country that we can work to improve them, and that is my job in the Southern Ontario area. And I have learnt, as I'm sure you have, that we will succeed if we continue to work together as partners, not competing against each other, but as a team, competing against the world. And folks, that really is the prime focus of FedDev Ontario. In our first 4 years, it was originally an agency that was launched for 5 years. So in our first 4 years, we already have committed $1.1 billion into the economic table of Southern Ontario, resulting, by the way, in partnerships with over 5,300 organizations. And those organizations were able to leverage an additional $1.5 billion. And I should say that that funding was almost exclusively from non-government sources. All of this to support businesses, organizations, manufacturers, and communities throughout Southern Ontario. Now, I can't talk about 5,300 projects, but there were a couple that I would like to talk to you about today. All of these projects, in the beginning, they were, in fact, to simply create jobs when the crisis was at its peak. I always like to use medical analogies, so when the patient was having a heart attack, we needed to deal with that. The fact that there was a kidney problem and some infections in the lungs, that was not the point to deal with that. But today it is. So as the economy started to change, the agency started to change. And today we look at creating more innovative, or agreeing to more innovative projects that would create those better quality, longer lasting jobs and ultimately produce innovative ideas that can move this process forward. We also look to the health sector so that we can help the sector grow and compete and of course encourage those people in that sector throughout Ontario. Now, one of the big projects, one of the first big projects that FedDev was involved in was our $20 million investment in the Juvenile Diabetes Research Foundation. Our funding is helping JDRF further develop an artificial pancreas for type 1 diabetes and simultaneously, of course, at the same time create a clinical trials network. Now, can you imagine the difficulty I had trying to convince people in Ottawa that this was not a health project, this was an economic project? Because as Dr. Snowden has pointed out, the world tends to think that way, that the two are separate. And frankly, they're not separate. As we were talking earlier, the business is actually the necessary evil of health care. Nobody likes it, but it's there. When I was in clinic, I used to say to patients, I'm here to treat you and fix you and make you better. The lady at the front is there to make you pay for it. So what we did in Ottawa was convince the powers that be that of course this kind of a project, of course it would save lives. It would improve the quality of life of millions of people around the world, absolutely true. But if we can develop an artificial pancreas and make it here, creating manufacturing jobs, they would in fact be high quality, high paying jobs. And with that kind of logic, we finally got approval on that project. Now I can tell you that our investment has in fact accelerated the invention, the testing, and it actually works, of an artificial pancreas. This system, we have no doubt, will revolutionize the treatment of diabetes, certainly of type 1 diabetes, not to mention lots and lots of high-quality jobs. Now, this type of targeted research is what leads to the development of new technologies that make us all healthier. They do, in fact, save lives, ladies and gentlemen, but they also improve the quality of life for those with chronic conditions. And that's exactly why the federal government must continue to invest in basic research. Of course we must. But we also have an obligation, a responsibility to move that knowledge out of the laboratories and into the hospitals and living rooms of the world, creating from that knowledge discovery certain social and economic benefits. Now, another project that FedDev was involved in later on, in maybe the second year, was an investment of $10 million into Sick Kids Hospital's Kids Arm. How many people have heard of the kids arm? Probably Kelly has, because she's the expert in this area. So this is a state-of-the-art, one-of-a-kind in the world robotic arm. It is a technique that allows surgeons to safely and efficiently perform less invasive surgeries on, guess what, our most precious patients in the healthcare system. I'm told that this robotic surgical arm will reduce the time the surgeon is actually in the patient by almost 90%. So this is why Kelly went into politics, because her job's about to be eliminated. So this is her retirement plan. Of course, I'm kidding. Now, the development of this arm, again, has great opportunity and great advantage to the treatment of our children, not just at sick kids. But folks, when we can reproduce and build this arm and the software and all that knowledge that goes with this type of technology and sell it to the rest of the world, guess what? We provide high-quality jobs, in this case already 80 jobs, for manufacturing workers, for engineers, for software folks, for clinicians, and so on. And as Dr. Snowden mentioned earlier this year, I did have the privilege, the honor to announce $5.3 million to help B'nai B'rith create the Center of Innovation Excellence for Alzheimer's Care, which, as you know, is managed in partnership with the Ivey International Center for Health Innovation. Now, our investment did, in fact, help construct part of that center, some of the construction of that center. Those are those quick jobs, moving money into the economy quickly, which other countries failed to do. And that is one reason why Canada did so well in those earlier years. But it also helped, this funding also helped hire 8 dedicated employees who are leading collaborations now with industry, with researchers and other not-for-profit partners. So here within the center, partners have already developed, they're testing, and they plan to commercialize new Alzheimer's technologies, products, and treatment approaches or protocols, with the ultimate goal, of course, of selling these devices for the betterment of people all around the world into international markets. Now, this is not only impressive, ladies and gentlemen, but it's very gratifying to see these folks put together a simple sensor, existing, frankly, existing technologies, but putting these technologies together to create a sensor that sticks on the side of the bed and tells the healthcare people down the hall whether the patient's in the bed or not, what the heart rate of the patient is, how long they've been laying in that particular position. In fact, some of the sensors tell them when the patient's in the bathroom, how long they've been there, and did they wash their hands on the way out. This is amazing technologies that will improve the quality of care, not, in fact, just for Alzheimer's patients, but you can see the diversity and the innovative abilities of these types of technologies, and that's why we push as hard as we do at the federal level. So you have to understand that I'm quite proud of these types of efforts by the federal government and the types of projects that we're investing, and it is very gratifying to be investing and working with partners like you who actually get it as well. Now, I can tell you our efforts overall in FedDev have put tens of thousands of people back to work and protected just as many jobs while improving the economic climate for innovativeness, for innovation, entrepreneurship, and collaboration. This has and hopefully will continue to improve productivity, and it has allowed us to compete better with other countries and other economies around the world. It has led, as I've just explained, to some very exciting and innovative ideas within the health sector that help improve the lives of Canadians, either from a social perspective or and an economic one, neither of which is really evil. But obviously, ladies and gentlemen, it doesn't take much to look around and see that our work is not done, that the global economy remains still somewhat unstable, and so therefore it is important that we continue, Dr. Leach and myself continue, and the rest of our cabinet, at trying to make sure that the nation does not slide back. But ladies and gentlemen, as Dr. Leach said, we can't do this alone. This is not entirely up to the federal government. Our businesses in Southern Ontario and across the country, 95% of our businesses in Canada have less than 50 employees. We are a nation of small business. They are our job creators. It does make it a little bit more difficult for them to have research and development capacity, but that's exactly why we've been merging our universities and colleges with our business sectors so that they all have that research capacity. It is imperative, more than ever that I can remember anyways, that these businesses need to be innovative. And they must improve their productivity. They need to access new markets. That's why we work so hard on free trade agreements with other markets. They must expand. If they already have markets, they must expand those markets. They must build world-leading products and find new uses for their existing products. They should integrate into global value chains to secure their futures. Our industries, including manufacturers, need to adopt these new technologies, and the equipment that they have must be state-of-the-art in their operations. Doing the same thing, ladies and gentlemen, that a company did 5 years ago, the same way they did it 5 years ago, using the same materials and etc., I would suggest that that company is already in trouble and doesn't maybe know it at this moment in time. Now, as I've mentioned many times, this applies to all sectors. All sectors in all corners of Southern Ontario and across the country, including, of course, the healthcare sectors. It is up to all of us to foster this culture of innovation. Now, we also know one thing, and that is that the population is aging. Not me, by the way, certainly not anyone in this room, but the population is aging, and on top of that, the number of aging people in this country is growing. We need to be able to make sure that our older folks, as I mentioned, much older than anybody in this room, but we need to actually ensure that our older folks have the quality of life that is in fact reflective of our appreciation for what they have achieved and what they have built, and that is the greatest country in the world. Now more than ever, we must invest in innovative health care and preventative measures and solutions, and that's exactly why we are here today. In September, just this last September, I was pleased to announce more than $15 million for the Connected Health and Wellness Project, which, as you know, is a technology platform containing an integrated suite of compatible technologies and apps designed to improve the health and healthcare of Canadians. This particular project, ladies and gentlemen, will allow patients to access and share, if they want to, their health records with their family, their friends if they want, and their care teams, including health coaches, which is an entirely new profession that is starting right now. Obviously, this is to help collaboratively, under a team approach, manage their healthcare conditions. Also, the hospitals and the physicians and the nurses and other healthcare professionals can have access, if allowed, and they can update the information, as Dr. Leach was saying, digitizing it so that it is in fact available no matter where they are at any time in the day. Now, this is all good news. I've seen this program. It's amazing, and I shouldn't drift off too much, but I have to tell you, if a patient has, for example, Parkinson's and is taking a certain amount of medication that folks know might not be absorbed as fast if you eat this kind of food, that kind of information would be automatically put on your file the second you got the prescription for the Parkinson's medication. That is the type of integration and the addition and uplifting of technologies and what they can do to improve the health of patients. But besides helping people, which is of course a great idea, this project is also positioning Southern Ontario as the leader in advancing health coaching, which is in fact intended to help Canadians, but also other countries around the world find new ways to decrease healthcare costs, while at the same time providing higher quality of care. FedDev Ontario's investment in Connected Health and Wellness Project is helping to create the conditions, to produce the environment that is necessary to make Southern Ontario's businesses and not-for-profit institutions global leaders in the development and the delivery of integrated electronic healthcare software, another win-win-win. Ladies and gentlemen, these are the types of things that we need to do, and we need to continue to do. Generating new ways of thinking, developing new ways of thinking and new solutions to old problems, all of which that result in improved health outcomes and a better quality of life for people here in Southern Ontario, across the country, and indeed around the world. And why not? Why not create high-quality job opportunities along the way? Friends, let me close by telling you what you already know, and that is without your health, you really have nothing else. So I want to thank all of you for your participation in this conference and, frankly, what you do every day. Because what you do every day not only generates great health benefits for Canadians, but your hard work is helping to create jobs and improve the economy at the same time. So Canadians get top-notch health care thanks to you, and they get better quality job opportunities thanks to you. I think that's a win-win-win. Thank you very much. Please enjoy the rest of your conference.